today is going to cover really information around why, do we need to bring a solution like Capital Wellness to the market, and really what need does it fit today. And then we'll talk a little bit about how it works and how you would interact with the Capital Wellness application, how your employees would interact with the Capital Wellness application. We'll go through a quick demonstration so you can see it live and for yourself. And then we'll talk a little bit about those additional value add components that you will most likely see as we go through the presentation and through the demo, but that we'll really want to highlight in terms of differentiating factors of the application. So when we looked at the health economy and really where the health economy is really heading, and that new health economy that we live in, you all as employers are increasingly taking on more of that burden of healthcare, and even, in some cases becoming actual payers and taking on risk. And when we look at the payer and providers, we're shifting much more to value-based care, keeping people well and out of the system, really transitioning from that fee-for-service and high-volume heads and beds type of a model. So there's a lot of changes going on in healthcare, as we all know, and there's a lot of solutions out there. But really, when we look at our solution, what a lot of solutions out there are, or a lot of companies are not looking at, is that consumer experience, is that personalization aspect of how do we really drive behavior change? Because at the end of the day, consumers are paying more and more out of pocket for healthcare than they ever have before. The days of the $10 copay are definitely behind us, as we all know. So we need to build empowered consumers and empowered employees, and we need to give them a tool in which it makes them easy. It makes them, it makes it easier for them to become that empowered employee and that empowered consumer. So when we think about, our employers and really what we're looking to help you do, it's your goals and objectives that you typically have when you're managing your business, your employee population, and now adding in this, this healthcare component of costs that rise and rise and rise year over year. And how do we start combating that? And are there ways in which we can take a very, I would say, innovative, comprehensive approach, but while making it simple for your employees to manage? So increasing productivity is absolutely something that we want to be able to help you do. We want to bring you immediate cost savings. And that's something that, when you look at the traditional world of prevention and wellness, cost savings and ROI has been something that has been a bit of a challenge in that industry. And, I think a lot of the times when I'm talking to clients or prospective employers, what I'm hearing from not only the HR department, but also the CFOs is we need to have a real return on investment. So we take that, very seriously, and you'll see, I'll point out throughout the presentation, really how we drive that return on investment. Improved morale and culture is very important to us. Really switching from engagement to empowerment. And really it's around helping people make better choices, giving them access to their own health information, connecting them to their family. And you'll hear us talk a lot about that throughout the presentation. And at the end of the day, what that really means is that we're bringing consumerism to healthcare. And we really want to create that healthy environment where everyone has access to a simple tool that allows them to take that step. When we looked at how we were building out our solution, what were some of the key components that we needed to solve for in order to really take into account all of the surveys and focus groups that we've done over the last decade or so around what are employees saying? And at the end of the day, it became really apparent that there were, three really kind of driving components to what we needed to solve for if we were going to be successful in the Capital Wellness platform. One of them being it needs to be easier. So I have a portal for all of my physicians. I have a portal for my insurance carrier. I have a portal or an app for my Fitbit. I have an app for, my Apple Watch. So I have a lot of different access points as a consumer and as an employee in which I have to manage all aspects of my healthcare. Then I take into account the additional employer-sponsored programs, and I have a login or an app or a website that I have to go to manage those. So what we heard loud and clear was It needs to be easier. I need to have, one single access point to be able to really take on this role of managing my healthcare and the healthcare of my family. Another thing that we heard a lot was, I need it to be more beneficial from a cost perspective. I need to see that value. So when we talk about empowerment and really having people participate, actively participate in driving down your costs, your healthcare costs, and improving your healthcare outcomes, we need to show them different value propositions and really realize those value propositions on a regular basis and early and often. And then the last piece being that we need to make sure that it's personalized and it's relevant to them. I think one of the things that we can all agree on is when the conversation is around, 75% of our population is going to be type 2 diabetic by the year 2020, there's a good portion of our population that's going to say, well, that's not going to happen to me. So when we talk about personalization, we talk about getting to the level of giving people access to their own health information and switching the conversation to, you are hypertensive, you are not on a hypertension medication. Let's get you into the doctor. Let's make sure that we get you on that, that right care pathway. And let us help you do that by allowing you to mobile schedule right from the application. And also we can get you connected and you can print out your entire record so that your physician knows exactly what it is you guys need to talk about. And we really guide that process. So being relevant, being personalized, and not having it be kind of general population based when we talk about education is very important to people because they want it to be relevant to either their health or their family's health. So how do we do this? And really at the end of the day, we aggregate, I would say, a lot of single point solutions or access points into one place and one application. It is mobile as well as desktop, and you have one administrative password to access all aspects of how you manage the healthcare for yourself and for your family. So when we talk about health portals, whether it's a physician portal or it's a lab portal or it's a Fitbit portal, all of that data can be directly connected, easily connected into your Capital Wellness application. It becomes the one place where all of your data resides. Your benefit services, understanding your benefit plans. So as an employee, we oftentimes hear that I know that my employer gives me extremely good benefits. We have a really good health plan, we have a really good program and access to a lot of programs. But really at the end of the day, I kind of forget throughout the year, what are some of those benefits and what are some of those services that my family and I can take advantage of so that I am utilizing the right types of services and really staying away from, or utilizing those higher cost unnecessary services, such as an ER or other areas. So we talk about, the fact that we want to bring all of that information into one place and have it be part of the workflow. So if it's Saturday evening and I have a child who has an ear infection, I want to be able to have one place that I know I have to go to get the answer on how to handle that. So we know that, telemedicine has a real return on investment. We also know that typically the reason why utilization is really low is because it's yet another fragmented service that they have to know to go how to access, and they need to know to use it. So we promote a lot of really good benefits. Whatever benefits you have, this is completely configurable. We also look at medication management. Medication adherence and medication management is a major cost driver of avoiding unnecessary hospitalizations, of making sure that people with health conditions are staying on track and they are really, I would say, maintaining that care plan that is so important to whatever condition they may have. And we want to be able to give them a tool that allows them to do that easily in the palm of their hands with all of their other health information. Financial wellness is very important. Lab results, you'll see that for yourself. And then when we think about other third-party integrations, I want you to think about this in terms of having your own tailored ecosystem, where if you do have a certain program that you're a certain, let's say a certain pocket of your employees really like, they get a lot of benefit from it, it's sticky to them. You can integrate that into this platform so that, again, you can really deliver that one application with one administrative password. We are very flexible with third-party integrations. When we look at the benefits for employees and their families, one of the things that we like to really point out up front is that we go well beyond prevention and wellness, and we need to in this day and age, because we have to really focus on areas in which we can drive down real cost. We can really drive improved outcomes, and we can offer a type of healthcare management experience to your employees that drives your productivity, your retention, and it really gives them that sense of, I can do this. And I think a lot of people, when you think about managing healthcare from A to Z, it's overwhelming and it's complex. But we really do, we spent a considerable amount of time, and you'll see it when we go through the demo, really thinking about and being very conscious of that consumer experience and that end user experience and simplification. So Capital Wellness application is very honed in on that. But one of the things we really like to talk about is the caregiving aspect. So, you read a lot today about how, employers are impacted by the sheer rise of caregiving, whether it's caring for children or it's caring for aged parents or someone with any type of a special need. We need to be able to provide tools and resources, because at the end of the day, we come into this world needing caregiving, and oftentimes we leave the world needing caregiving. And throughout our lives, we go in and out of being patients and consumers. So we need that one place where there are tools and resources to help us when we're transitioning in and out of those roles, to make it more accessible and to make it more convenient to be able to proactively and effectively take on those roles. We talk about disease management. This is an area specifically for me where I've spent a great number of years in my career really focusing on serving individuals with specific health conditions and working to not only provide relevant education, but to close gaps in care quickly, to look at, and have a program in place where, we can give people access to labs where it tells them that they are actually pre-diabetic, but you're not type 2 diabetic yet. You have a window of opportunity to completely back down that cliff so that you do not become a high-cost patient for life, or someone who is, managing a chronic condition for the rest of your life. So we really believe quite adamantly in proactively getting in front of and using data to give us the right signals to avoid the onset of conditions that are very costly and that really, just have a major, major impact on quality of life for individuals. Closing gaps in care around medication adherence, vaccines, preventative screenings, all of that is embedded within the tool. So when we say going beyond prevention and wellness, we really mean that, we're looking at services and programs that have been performed by health plans and physicians for years. They have a real ROI, and they're now available to you as an employer through the lens of your employees. So everyone's working together toward the same goal. Financials, we talk about having access to your out-of-pocket, being able to understand where you are to your deductible, also being able to tie into HSAs and FSAs. We need to start helping our consumers learn how to plan for healthcare and be able to be a resource to them. Again, I know there are great financial single point solutions out there, but unless it's part of the entire workflow and you're looking at financials and insurance and claims alongside clinical and gaps and all of the, other activities that you have going on as an individual when it comes to your healthcare, it becomes overwhelming, and you need to be able to really sort through it and have a simple way in which to manage it. At the end of the day, what you're looking at is a complete risk management solution where we provide best-in-class solutions to our consumers, to your employees, even as the healthcare landscape shifts over time. And the one thing I'll just do before we move on is I just want to give you an example to say today, maybe the best way in which to drive an ROI in your population and to provide an innovative solution that your employees really like is telemedicine. But what I want you to think about is when you implement a single point solution and it's telemedicine, you are really driving and promoting that one service. Let's say in 18 months, we've moved beyond telemedicine. There's another more innovative, more improved service and program that's available, but you don't want to be locked in. You want to have a partner like Capital Wellness where you have the flexibility and we actually go out and shop the market for you to look at what are your specific needs and what do we need to plug in or unplug and replug someone else in so that we maximize your return on investment. that your employees are getting the best possible healthcare experience they can get for themselves and their families, and we take on that for you, but we work with you in which to identify what is that best tailored program for you. So what does the application look like? I'm going to give you a quick overview here, and I'm actually going to jump into the demo so that you can see it live. We are a application, again, we talked about mobile and desktop. We are built on 4 key pillars. The first being, in order for people to be empowered and to really become better healthcare decision makers, we need them to understand their health like they understand the health of their car. So if we think about our routine oil changes and the fact that we have those check engine lights that come on, we don't take that same type of rigor with managing our healthcare. And it's because it's difficult. Our data is everywhere. There's a lot of, I would say technology and business barriers in terms of being able to pull all this together. This is by far the most, I would say, comprehensive and special aspect of Capital Wellness that you'll find, is that we've worked rigorously over the last 2 years to build out this capability for employees and for consumers to be able to bring in all of their health information in one place. Now, I know the first thing that's going to come to all of your minds most likely is we don't want our employees to think that we have access to this. So we'll talk a little bit about that, and we'll talk about how we absolutely educate folks on safeguarding their data and what is usable and visible versus what is not. And at the end of the day, the way that we typically promote this to employees is this is for them. And this part is, because this is the front end experience. This front end experience is absolutely for them, because we're now giving them a seat at the table. We're telling them that they can be economic drivers of helping us solve some of the cost and quality problems of healthcare. So by giving them access to this, we really do relay it in a way that says, you have, excuse me, I'm a little under the weather today. You have the ability, with access to your own data, when we simplify it and we make it completely consumable, to start to be able to plan and understand how to take care of yourself like you do your vehicles. So we think about this in terms of health insurance data, connected health data. So if anybody is on a cloud-based remote monitoring device, a glucose meter, a Fitbit, any type of a tracker, all of those connect into our platform. And what that does is it provides us real-time data every day and it's present health data. It's impactable. So if we can get beyond looking in the rearview mirror and getting those quarterly reports that show us how well our plans performed, and we can move into how is my plan performing today, because I have 40% of my population on some type of a remote monitoring device, a connected device, and I can see in real time where do we need to focus and what interventions do we need to deploy, how do we need to get people to take action versus what percentage of our population is good from a maintenance perspective. So it's very important when we talk about access to healthcare data and giving people that level of access for their entire family. We then take that information, and we provide a personalized health journey. This is an incentivized gamification platform, and what it's designed to do is to be that one trusted, neutral, third-party resource to us as consumers to say, you're hypertensive, you're not on hypertension medication, your A1Cs are elevated, your last 2 lab draws, you're trending in the wrong direction. What does this mean? Let me educate you. Everything in our personal health journey is individualized and personalized based on people's data, individual data. So we're moving way beyond your typical population health, way beyond your typical prevention and wellness. We include it, but we know that the major ways in which to make a change and have a major impact is to really get to what are those items that are going to most likely, what are the items or the areas where you're most likely to have a costly claim event or some type of a medical event that we can avoid. Everything in the personal health journey is designed to take less than 2 minutes. We want people to earn points and rewards. We want them to feel that additional value. We want them to get that sense of they're accomplishing something, they are progressing. And they're not only doing it for themselves, but they're doing it for their families as well. And then we have personal health services. This is where we talked about if there are programs that we want to continuously make sure that we put in front of people because it is beneficial to them individually, personally. We want to make sure we can plug those programs in and provide them conveniently in one place. We also bring everyday kind of modern day on-demand services to them as well, such as online mobile scheduling for appointments, being able to find your doctors, knowing whether they're in or out of network with the click of a couple buttons, being able to talk to a doctor in under 15 minutes with 3 clicks of a button, or being able to price shop your prescriptions, because again, value. We want to bring value to people and give them a reason in which to come back to this whenever they need us, or to be able for us to be able to push something to them on their mobile device and say, we need you to do something. And we do it in a way that is very, I would say, not abrupt, not invasive. But again, most people are used to getting those types of push notifications on their phone to say it's time to come in and do something into your phone. And then the last piece being the Health Tribe. This is a component where we absolutely have seen tremendous value across our client base, where we allow all of our users of the Capital Wellness application to share as much or as little information with whomever they please. So think about how we consume health today. We don't do it in a vacuum. We don't do it on our own in most cases. And if we do, that's a tough place to be. But really, in reality, we do it as families. We do it with our friends and loved ones, or our physicians, or our trusted coaches. And we don't have a mechanism today in which to conveniently just send someone an alert or give someone access to your personalized health journey and say, you know what, this is a little overwhelming for me. I have a lot going on from a health perspective. Could you potentially help me? Because, you know, I rely on you as an individual or as a friend or a family member to do that. I'm going to go ahead and give you access to my account. That way you can get the same alerts that I'm getting. So if I'm not filling my prescription on time because I'm going back and forth, or I'm having issues with getting to my appointments, I can actually have you receive those alerts, or I can send you an alert and say, is there any way that you can help me get to my appointment next Thursday? The biggest thing about this for us is the more we're caregiving and the more that we look at this aging population that's, you know, on average has 2 to 3 chronic conditions, that funnel of all the people behind them that are coming behind them that we're all trying to, you know, really get in front of, the best way to activate them is to leverage their loved ones. You know, I always like to say, if I get a phone call from my insurance company telling me that I have a gap in care and that I need to go do something, it's a lot less impactful than if I get a call from my aunt who's a nurse who I've added to my Health Tribe, and she says, Sherry, do you know what this means? You need to go do this. Do you need somebody to help you? Because we can do that. You're activating an entire tribe of people to help you drive down your costs and improve your quality at the end of the day. All right, so with that, I'm going to go ahead and jump into a quick demo so that you can see it. So give me 1 second here. All right, when you can see my phone, there we go. All right, this is a live demo of the Capital Wellness application. All right, so you can see that I'm logging in via my fingerprint, which from a convenience perspective, again, we take a lot of polls. We do a ton of surveying of our, not only our existing employer clients, but and other types of clients, but we also look at, we go beyond that. We actually take polls using national tools that allow us to really extend our reach. And I can tell you one thing about the iOS fingerprint touch, it makes it very accessible. So logging in for some people has become a thing of the past. So the fact that we have that is something that we know drives a lot more usage than an application that does not have that. So you are landing in the dashboard of the Capital Wellness application. I can see as a user that I'm 83% of the way of finishing my account setup and my profile. So think LinkedIn or, you know, Facebook and other applications where you really want people to get a sense of how close are you to completing something, because that's really a driver behaviorally for a lot of us. You can see that right off the bat, you can see where you are in your health journey. So this is an established demo account. I'm going to walk you through how easy it is to set up with us and how to get your users onboarded, your employees onboarded when we go back to the presentation in a minute. But what I wanted to show you here is the everyday experience of your employees really boils down to how do we activate them? How do we empower them to take the steps that they need? Well, we gamify it a little bit. So there are levels, there are stages, there are points associated with everything. And there's rewards that we want to give people. And the best thing to do is reward people early and often so that they really start to understand and get the value of what's in here and what can really, what's most beneficial to them and their family, because it's not the same for everyone. And we thought about that, and we were very, very conscious of that as we developed all these different aspects and brought them all together into one cohesive experience, because what may be beneficial to me may not be the most beneficial thing to you. But at the end of the day, we need to make sure that there are value add components for everyone. So you will see here that there are multiple challenges, and we do call them challenges because, again, we're looking to gamify this. There may be some upcoming events that you can see directly from your calendar. So if I have an upcoming doctor's appointment, if I have an upcoming yoga class, because I can also add those because I tie those into my rewards. Or it could just be something for your family. And I do want to point out that it is a family application. So if I am Elizabeth Blackwell and James is my husband, I can actually go in between, and if I had 3 children, I could add those 3 children as well. So it's absolutely a tool in which, if you have certain employees where it's not a per family per month, or it's not a per family, a family-based solution, if you're only giving access to your employees, and those employees are not the ones that typically manage healthcare in that family, then you may be missing out on a major opportunity. Because what we want to do is we want to activate that one person in the family, and it may not even be your employee, it may be their spouse, to effectively be able to manage the healthcare of their family and work with you to drive down costs and improve quality. So we find that this is a major beneficial aspect, because for me, I can go in and I can make sure all of my children's appointments and preventative and routine care are scheduled on time, that everybody has access to it, that my children who are of age of 15, 13, and 12, that they can actually download it to their native calendars on their phones. So because I'm scheduling it for them through my mobile appointment scheduling, and I'm making it visible to them, they can start almost seeing, and being somewhat accountable for it as well. The other aspect to the dashboard is that there's always features. So we want to make sure that whatever's going on right now, that we are featuring certain articles and education, and we do this in a lot of different ways. You'll see here that you do have access to your digital health wallet. So we work with you during implementation to configure, oops, sorry, that was not the right one, to configure your ID cards ahead of time. So you can actually go in and you can share these by sending an email. So when I go to my doctor's appointment, if I have a new card that year and it's around the January, February time period, and I need to give them an updated card, I go ahead and I email it directly to the front desk individual, or I can actually print it to the nearest wireless printer, but I actually use the email function because I find it to be a little bit easier. So those are your medical ID cards. Those we can configure by working with TPAs, carriers, other partners that you have in your health and benefits program. But as an individual, I can also add additional cards. It's as easy as taking a picture of the front and back, and I can essentially build out my entire digital health wallet. So everything is accessible in the Capital Wellness application from the left-hand menu bar. So you can see here that there's a menu of items. You have your health journey and rewards. So we introduce people during onboarding and registration to what does that mean. You can also see in the dashboard kind of what that means, and we introduce you and we really educate when you onboard around what are the benefits of your personalized health journey. How do you make the most of your rewards? And then we talk about the health tribe. How do you build out your health tribe? How do you get access to all of your health information? So my health is where all of my health data about me, and again, my family, if I want to toggle between accounts, where I can get access to all that information. My doctors, my medications and pharmacies, my claims, my financials, my health calendar, and then support on anything that anyone needs. So as you can see, it's very intuitive. You really know where to go wherever you need to access any type of particular component. When we talk about my health, it's a very simple chronological timeline where it pulls all that information from all those disparate portals, all those fragmented data sources out there, where if people don't realize, our data is really everywhere. Everywhere we ever receive any type of health service, there's a record and there's data on us. We want to be able to bring it all into one place so we can make sense of it and we can really simplify it. So understanding that you had a comprehensive metabolic panel, which, if someone doesn't know what that is, they can actually look it up in the application. We have definitions and things where you can click on a little, information icon and it'll give you more information. But really, at the end of the day, we find that a lot of this is, people do understand when we break it down to this level. Your periodic oral exam and adult cleaning makes total sense. We have a normal physician visit where you're getting preventative medical care. So all of this is much more beneficial in a chronological timeline where you're pulling, as you can see, from multiple physicians, multiple different locations, different health systems, different types of providers. It's much easier to manage in this capacity. We do separate out labs. So you'll see here that, something like an albumin, which is part of your comprehensive metabolic panel, which it says in here, we actually show you over time how your labs are performing. So think about that check engine light for your car. This becomes our collective check engine light between your employee and our system, which has all the intelligence built in to know exactly when it's time to alert your employee of, what does this mean to me? What do I have to take any actions right now? Is it time to go talk to the physician? What should I talk to the physician about? What are my follow-up items? All of these things are extremely beneficial because, one, we're changing the dynamic of the conversation. We're no longer saying, hey, it's important to understand albumin because of X as a population. We're now saying it's time to start learning about this because maybe you're trending in the wrong direction. For this particular person, they're doing fine, but if it was going in the wrong direction, we would want to intervene quickly. And the application does that for you. Connected health. So a lot of people, nowadays have a little bit veered off of the Fitbit, or, maybe they went more to the Apple Watch because it has a lot more value add features. It's a little stickier in terms of it can help you with things even beyond steps. So we look at this as in a couple of ways. One, there is absolute value to understanding your data, just like your car understands exactly, when you're running out of gas, it gives you the gas light. So understanding your data is great. What Fitbit and others have really kind of missed the ball on, I would say, is they're not turning that data into action. So data without action is just information. Information is an app on your phone that is not going to get used a lot. It needs to be something that's going to motivate you to drive you to take action. So we use this data in a much different way. And we also are very persistent. So if somebody wants to change, think about if you wanted to change from a Fitbit to an Apple Watch. Let's say you're on that Fitbit for 2 years. The second you go to that Apple Watch, you're starting over. You have no historical data. You don't know how many steps you took. You probably remember because most people kind of get the sense for what their norms are. But wouldn't it be great to be able to carry your data with you wherever you go and to really be able to keep that persistency factor? With the Capital Wellness application, you get that. If I wanted to switch from whatever device I'm tracking today and I wanted to change it tomorrow, it's as easy as connecting that device, going in and indicating what type of device it is. Typically, when you get a new device, they give you credentials to log into their portal. So you'd have a username and a password. You enter that into your Capital Wellness application. You never have to go to that other portal again. It connects you, it turns it on, and it keeps your history from your Fitbit because that's your data. And that's personal, present healthcare data that allows us to really drive an impactful experience for you, and it allows us to proactively get in front of avoiding high dollar cost items for you, which is probably the most difficult part. This is your personal health record. This is where you go and understand your allergies, your diagnoses, your active medications, your procedures, any types of vitals that were pulled for you last. So this is your one-stop shop. We also go ahead and we talked a lot about closing gaps in care and really working from a disease management perspective or a case management perspective to really hone in on what do individuals need? What are their most pressing health concerns that we know as an industry have real ROI behind them? Because if we don't address it, there's going to be a high cost event. We want to avoid that. So we actually converse directly with your employees around what are your care needs? You have cholesterol levels that are a little elevated. It's time to start managing your cholesterol levels. These are the things that we say, talk to your doctor about these things when you go. And you know what? You can even go a step further. You can email it to them ahead of time. So you can do it from your phone. So they can get access to that information. You're having a conversation now that's meaningful. And really what that doctor's getting is access to data and information that they typically wouldn't get, because this is all compiled across all physicians. So when we talk about that shift to value-based care, this is the start to that. It's introducing consumers to say, I'm empowered to help you keep me well versus kind of driving in the sick care system that we typically live in. So this is your health journey. This is where anytime we need that information that I just showed you under My Health to turn into action, we engage you here. This is where we empower you to take those actions. So the first thing that you'll notice is that we do have points. Those points turn into rewards. Our rewards library is very extensive. We try to always have a local component. So even if you have multiple locations, we want to introduce your employees to services that are, that are health focused, but also a variety of different types. So connected devices, wearable devices, all different types of fitness. So the days of giving people, a membership to their gym are long gone. There's a lot of different ways we can be physically active, and everybody has their preferences on what they enjoy. So we want to introduce people and make it beneficial for them from a cost perspective by giving it to them for free. Because if they are truly participating in the healthcare of their entire family and managing that, we want them to get that reward. We want them to get that sense of satisfaction. One of the great stories I like to show, or I like to share in this, is that we recently had a client where one of the users sent us a testimonial. And the testimonial specifically said, I just found out recently I had a major gluten allergy. I had been not feeling great for about a year, and I finally realized and honed in with my doctor on what exactly was going on. And now that I know what my allergy is, she said my next biggest hurdle was, how do I change my lifestyle? How do I learn to cook completely gluten-free? How do I make sure that I'm not just making food for myself and making other types of food for my entire family? Well, the first thing we did in the application, which she thought was amazing, and it really, really elevated her experience with us, was we recommended that she switch her reward from a wearable device to a week's worth of gluten-free meal delivery so that she could start really seeing and getting that convenient help as a resource to say, here are 5 meals that you can make that are going to make you feel better. They're going to be tasty for your family. And oh, by the way, this is free to you because you've been doing what you need to manage your healthcare. So we want to pay it forward. So that was a really good testimonial that we received. We thought that, that was very validating for us, that we are helping people in making those types of transitions when it comes to managing their health. One of the things that you'll notice in here is that there are a lot of different types of activities, because we not only look at closing gaps in care, but we also look at what is meaningful to you as an individual. So if I go in and I tell you, and I tell the application throughout the various kind of little mini assessments that we do that you're earning points for, again, everything takes less than 2 minutes. If you go in and you tell me that your 2 top concerns are sleep and stress, then the application knows to prioritize those alongside any gaps that you may have, and to really present them to you equally, so that we're not only telling you what you need to do from a clinical perspective based on evidence-based guidelines and recommendations that are, ADA, AHA, all of it credentialed, but we're also taking into account what's concerning to you. So we want to make sure that we're doing that at all times. When you look at the types of activities that are in here, they're 1.5-minute videos. Maybe it's a podcast, maybe it's a slideshow, or some type of a game. We do it in a lot of different ways, and we start to learn what each individual employee enjoys and how they best receive information. And we look at, if somebody is taking the right actions when they're able to watch a short video that gets the message across, and that seems to be successful for that person, then we may introduce more videos to them in their journey than maybe someone who doesn't like the videos, who would rather listen to a podcast because that's how they learn. That's how they like to receive information. They're more of an audio versus a visual. So the other aspect of the journey that I like to always point out is that you can create group challenges. You can create departmental challenges. This is customizable. So it comes with the base components of all of your condition management, all of your normal health risk assessments, your fundamental aspects of nutrition, fitness, stress, sleep, all of the education that comes with that, and all the surveys that we need to personalize the experience as much as possible. But if there is something that you want to promote, we have an admin screen where you can go in and add your own challenges and decide who in your population you want to receive those challenges. The health tribe is very simple. You can just go in and add a health tribe member. It's as easy as identifying the first name, last name, the email address, and then what do you want to give them access to? And at that point, they get an invite via email. They can download the Capital Wellness application, and it's at no charge to them unless they want to turn it on for themselves. And then there would be a charge for that. My Doctors, this is where you access your telemedicine. This is also where you access your doctors that come in through your claims. So when we collect your claims, working with your broker, your TPA, all of your partners in which you deliver your health and benefits program, we want all of that data to come in so that we can start really bringing all of that intelligence and that insight directly to your employees. But at the same time, if I know that Dr. O'Reilly is submitting claims for me, when I come into the application, one, I want to turn on medical record authorization, which it tells me I can do right there and then. And it says everyone has access to their records. Do you want yours? Absolutely. But it also tells me that, you know, this is my PCP. This is how I get in contact with them. I can mobile schedule. I can look at all the various locations. I can see what specialties there are. So it really gives me a lot of information that typically I have to go to carrier sites that are, I would say, historically kind of notorious for being outdated. No offense, I come from that world, so I'm qualified to say that at this point. But yeah, so it's really just a convenience factor. And then being able to find a doctor is as easy as going through and understanding the specialty, and then knowing how far away, you know, you're willing to travel to get that list. Medications is another area where, again, when we talk about closing gaps in care and we talk about ROI and engaging people and being able to effectively manage their healthcare, medications is a huge component of this. Being able to get alerts that it's time to refill, being able to understand the fair cash price of any drug, understanding whether or not you want to turn on a reminder that says, I have to take this with food. This is what this pill looks like. I want to activate my health tribe to help me manage my medications. And at the same time, you can also get really important information if you do end up having some type of an adverse side effect where you have access to that information that was on the white bag when you picked it up, but maybe you throw it away, because we typically do throw it away. You can get access to that information in the palm of your hands. So we really feel that medication management is a major cost driver, and we know that historically from an ROI perspective, it's one of the key components. This is where you get access to your claims and financials. So you can see exactly where you are to your deductible, to your out-of-pocket progress. You can see your 12 months of utilization of services with your health plan, with your claims. So we start really educating people on how do you get access to information that's going to be a little bit more helpful than what we have today. So one of the big things is everybody has a pretty, I would say, similar viewpoint on explanation of benefits. They're kind of confusing. They're definitely, I would say confusion is definitely probably the biggest feedback that we've seen in surveys and focus groups. So we simplified it. You don't need to get an EOB that has, you know, this is not a bill with 5 pages of language that you don't understand. What we want to say is we're going to simplify it and boil it down to the most basic level. You saw Dr. Nina on August 9th. The claim was for Elizabeth Blackwell. You owe, you paid, this is what was billed. You know, these are the components that you need to understand. And we do this for all the encounters because we get that direct claim feed from your carrier. And this is a better way in which to really, I would say, have people understand how much things cost and how much you're paying and how much they're paying, and really starting to understand the value of that. So we do a lot when it comes to that in terms of educating people on, did you know you could use a service that would cost you and your employer, you know, 30% less, and this is what this looks like. So we do a lot when it comes to that. Your health calendar is exactly that. It's a calendar feature. I won't spend too much time here. There's a lot of things I want to cover when we get back. And then your support. So you have access to live chat agents. You have a fully customizable knowledge center where you can put all the information about your benefits, any FAQs,
health topics from A to Z, and then tutorials that help you really navigate throughout the application if you have any questions. And then, of course, you can email us or you can schedule a call with us to help you with anything that you need. So at this point, I'm going to go back to our presentation and just walk you through a little bit about, let's talk a little bit less about the employee experience and let's talk a little bit about your experience. So the employer, when we looked at this, we really felt that it was important to apply simplification to you as well. One partner, one contract, one application to go in where we can integrate as many or as little other programs as you want to make it simple for you to manage the offerings for your employees. That was very important to us. When we talk about some of our major differentiators, data transparency is one of the biggest ones. So giving you access to data that you've never had access to before at an aggregate level. Again, we are true to our word when it comes to, regulatory compliance as well as privacy with your employees. But the level of aggregated data that helps you understand risk, that helps you get proactive alerts to avoid unnecessary costs, and to have access to a dashboard that changes every day. Your employees' health changes daily. Your data should as well. So we don't believe in rearview mirror quarterly reports. We give you an account manager that helps you look at these alerts and to make the best decisions on what to do. How can we support you? Do you need to plug in a specific program because you may have a certain, small cohort of your population that, needs a diabetes prevention program because they're pre-diabetic. You didn't know that 6 months ago. You now know that. Now we can put the right program in place to address it. That's also a reimbursable service, by the way. Even if you're self-funded, I know that you pay for that, but it's much better than not knowing and dealing with the consequences of kind of what happens down the line. Communication management is a major aspect. We go beyond that once a year open enrollment. We have year-round benefit education and access. We promote your benefits. We want people to utilize the services that you're finding for them, that you are contracting for them to receive, and that you believe will have an impact on them. We believe that as well, so we want to promote that. You have personalized content and delivery at all times. You can reach anyone, anytime, anywhere, because you're in the palm of their hand. Cost containment. This is a place where we have pretty extensive backgrounds and experience. When we get access to your claims, we also give you insights into how is your claim spend performance. How is the performance of your claim spend? So we do claim payment validation. We will collaborate with you and your TPAs and carriers to provide reports on that. Essentially, at the end of the day, we want you to know exactly what's going on within your health plan so that you can get those insights and that you can see that we are absolutely, we have the ability to drive ROI here as well. If you are self-funded, if you're fully insured and you are planning on going self-funded, being able to get access to this level of data and then being able to know that your solution provides complete cost transparency or cost containment so that when you are, or when you do get to that point where you're self-funded and you're giving away kind of the pin to the ATM, that you have a third-party trusted partner that's watching every dollar to make sure that you are spending that money appropriately and that those types of controls and monitoring are in place. From a competitive advantage perspective, we feel that, giving employees this type of a tool gives, from a retention perspective, we've seen it heads down. And then measurable ROI. Obviously, that's a major component. It's a focus. Nothing goes in our application unless it does three things. One, it has a true cost reduction aspect to it. Return on investment, lowers our cost, but at the same time, it has to improve quality. We don't want to lower costs without improving quality. They go hand in hand. And then the final piece is it has to simplify the experience. It has to be convenient. It has to be on demand, and it can't be yet another barrier to us achieving our cost and quality goals. When we talk about engagement, we've redefined engagement, or actually recoined what engagement means to us, and it really translates to empowerment. So when we talk about engagement, we really talk about how do we empower consumers to be, to be able to manage this effectively, to be able to be better healthcare consumers. And really at the end of the day, it's about being there when they need us and engaging them when there's something that we need them to do. So we look at all demographics. It's your young invincibles that may not have a lot of claims experience, might not have a lot going on from a health perspective, but there's definitely value to connecting all of their wearable devices. They're very technology forward, giving them access to their health information. They're definitely data seekers in a lot of cases. Empowering them to close their own gaps in care, to make sure all their preventative care is completed on time, and then giving them rewards that they can earn, you know, freshly prepared meals or more connected devices for free. Definitely resonates with that population. You know, a busy mom, that's a no-brainer. You know, you're talking busy dad, busy mom, busy anyone professionally who's, you know, got family that they're managing as well as jobs. You know, you give them a convenient tool that allows them to be more effective in this, and that they can actually save money out of pocket for their healthcare costs for their family and avoid any unnecessary conditions that would plague their family. It's definitely, it's resonating. And then obviously when you get into the older populations or the populations that really do need a little bit more help, this, you know, very much applies to that population. Okay. I do want to just do a quick time check. I know we have about 6 minutes left. This is the last couple of slides. So I do want to illustrate how easy it is to onboard with Capital on this. So we can get you up and running in less than 30 days. We can get you connected to, we can get connected to all of your various data sources, so carriers, TPAs, others. But when we talk about your onboarding experience with your employees, this I want you to see as a 1, 2, 3, 4, and we're done. The platform takes over. All of the intelligence, the data, it all starts working with that individual and it tailors that experience. But when you register, your information is already loaded because we worked with you to get eligibility data. And then we add in your family members. We then make sure that your doctors are added in, and that's as easy as either searching and adding them or verifying, because we have claims that yes, this is your doctor. They go into that My Doctor section. The next time you can go in and connect all your medical records. You can connect to your insurance. Typically, we work with you during implementation to do that. So sometimes for your employees, it's a quick validation and it's 2 clicks of a button. And then you can get your devices connected if you have them. If you don't, you skip that step and then you start really engaging in your health journey. This is an example of a use case. We've gone through quite a few over the dialogue of the call today, but you know, getting an alert that your blood pressure is high, learning about why that's important, and then checking in with your doctor and getting that scheduled right away is a very, very quick timeline of intervention to avoid an unnecessary event that would have otherwise not been detected. All right, and that's your Capital Wellness application.
Sherry, thank you.
Absolutely.
Yeah, thank you for the time. I appreciate it.